Hello, dear students. I'm Dr. Sujata. I'm a gynecologist and obstetrician. I'll be talking to you about the anatomy of the female pelvis. So, the female pelvis is a very integral part of a human body, because this is the part that connects the upper trunk to the lower part of the body, and this also gives a support to the human spine and the trunk. So let's see what the pelvis consists of. Consists of, one, the bony pelvis; two, the cavity within the bony pelvis; and then you have the pelvic floor, which you cannot see here because that is made up of muscles; and the perineum, the part below the pelvic floor. So let's look at the pelvic skeleton. The pelvic skeleton, it is made up of the sacrum and the coccyx posteriorly. So let's look at it in this angle. Sacrum is made up of 5 vertebrae. Normally, as you know, the vertebrae are small bits of bone stacked, piled up around over each other, and these vertebrae are normally not fused to each other, but they just pile up. But in a sacrum, these 5 vertebrae are fused together to form a single bone. So this is the sacrum, and this is coccyx, which is also the tailbone, which is made up of 6 vertebrae, and they are fused together. So this is the posterior aspect of the pelvic skeleton. Then you have what is called as, on the sides, this is the ilium. On both sides you have what is called as the ilium. This is the bone that you feel when you place your hand on your hip. The bone that you feel is called as the ilium. So then you have a bone in the front, which is called as the pubis. So this is a pubic bone, this is another pubic bone, both of them from left and right fused together in the middle to form the pubic symphysis. So this is the pubic bone. Then you have what another bone, a part of the bone of the human pelvis, is the ischium. This is the ischium, and this is the bone that you feel when you're sitting down. When the patient sits down, when the person sits down, this is the bone that uh, touches the surface. This is the bone that feels hard when you're sitting down, especially on the floor. So this is the ischium. So this together forms the pelvic skeleton. So this pelvic skeleton encloses a space called as the pelvic cavity. So this cavity is the pelvic cavity, and within the pelvic cavity you have multiple organs, that is the bladder, the uterus, and even the rectum. These are all the pelvic organs that are placed in the pelvic cavity. So after the pelvic skeleton, you have what is called as the pelvic floor, which is a dynamic structure, which is composed of a muscles, which extends from one ischial tuberosity to the other ischial tuberosity from side to side, and also it extends from the front in the pubic symphysis to the coccyx and the sacrum at the back. This is from front to back. So this is more like a hammock or a cradle like structure, wherein the pelvic organs are cradled and they support. So this is what the pelvic floor is made up of after the pelvic cavity. Pelvic floor is made up of muscles like the levator rani and the coccygeus. The levator rani is made up of 3 layers of muscles, that is puborectalis, that runs from the pubis to the coccyx, between the pubis to the rectum, and then you have pubococcygeus, that is from pubis to the coccyx, and then you have iliococcygeus from ilium to the coccyx. So these 3 together form the levator rani, and then you have another coccygeus muscle, which runs from the ischial spine to the coccyx. So these are the pelvic floor muscles. Beneath the pelvic floor muscle is the pelvic membrane, perineal membranes, and then you have what is called as the external skin or the external genitalia. So this is what the pelvic floor is made up of. And let's look at the muscles of the abdominal wall. In the abdominal wall, you have muscles which are rectus abdominis, and you have other oblique muscles. Rectus abdominis is the center muscle, centermost muscle. This is the muscle that is what people try to get 6 packs and 4 packs when they are doing exercises. This is the muscle that comes in packs, that is the rectus abdominis. You have one muscle on either side, and the middle they fuse to form the linea alba by the covering which they are covered with, which is the rectus sheath. And after the midline on the sides, you have a muscle which come in oblique fashion or diagonally. That is why the name they call as obliquus. So that's external obliquus or external oblique muscle. Then you have beneath the external oblique muscle is the internal oblique muscle, and beneath that is the transverse abdominis muscle, which comes in a more horizontal fashion. So these are the muscles of the abdominal cavity. So what is the importance? Like I said, it gives a supporting function. It supports the trunk and the upper part of the body. It connects the upper part of the body to the lower part of the body. It transmits weight from the upper part of the body to the lower limbs. That is the function of the pelvis, and it also transfers weight when you're sitting down from the upper part of the body to the ischial tuberosities, and it provides support to the pelvic organs and the abdominal organs, and also protects the pelvic organs. Pelvic floor, perineal muscles. Beneath the pelvic floor is the perineal muscles. These muscles are made up of ischiocavernosus, bulbospongiosus, transverse perineal muscles, and of course the lower part is, you can see the levator ani muscles, which we had seen from up above. So these three muscles, which are ischiocavernosus, bulbocavernosus, and transverse abdominis muscles, these three muscles are more exposed when you see them from down below, that is from the perineal aspect, and these muscles are more related to sexual functions. Then let's look at the types of pelvis. In the types of pelvis, we have 1 gynecoid pelvis, 2 android pelvis, 3 anthropoid pelvis, and 4 platypeloid pelvis, which is very rare. So gynecoid pelvis, as the name mentions, it is seen more in women, or the female pelvis. That is why it is called as a gynecoid pelvis. And then you have android pelvis, which is common in the common in the males. So it is called as the male pelvis or the android pelvis. So what is the differences between gynecoid pelvis and android pelvis? Gynecoid pelvis is more round and shallow, and it is more open. Open meaning the outlets of the pelvis is more open, so it facilitates easy delivery during childbirth. Whereas in the male pelvis, it is more heart shaped or wedge shaped. It is so having more AP diameters. So this causes reduced pelvic outlet, and it's difficult to deliver the baby in an android pelvis. Then you have other two pelvises, that is anthropoid pelvis and the platypeloid pelvis. Anthropoid meaning ape-like. It is seen more commonly in apes, standing apes. So this ape-like pelvis, this pelvis is narrow and it is deep. So the diameters are all small and it is more deeper, which is very difficult to navigate during childbirth. So this is more like an egg standing upright. So this is a, we put it's an upright egg shaped fashion, the cavity is. This is also not feasible for normal deliveries. And then you have what is called as the platypeloid pelvis, which is a flat pelvis. In here we call it as the egg lying on its side. So it is more horizontally placed. It's a flat pelvis. It is very rare type of pelvis. Even in this pelvis, it is very difficult to deliver normally. Normally at the time, just at 37 or 38 weeks of pregnancy, every woman is assessed to see how her pelvis is. So what are the parameters that we look for when we looking, why is it important to assess the woman's pelvis before delivery, that is at 37 or 38 weeks, is because we have to assess whether she will be able to deliver normally, vaginally or no. And by looking at the parameters, we will be able to assess whether she will deliver normal or no. And these things, to see the type of pelvis, to see the diameters of pelvis, as of now there are no equipment or no measurement besides clinical examination. So we put two fingers in the vagina and try to look for the pelvic diameters, and then assess whether it is a gynecoid pelvis or android pelvis or what type of pelvis it is, and we will thereby able to assess the lady for her future delivery, or whether she needs a C-section or whether she can be given a trial. Thank you.